Hello, everyone. Welcome to this Facebook Live. My name is Tony, the outreach coordinator at AMI-Quebec, and today we're talking about. There it is. Does my loved one have a mental illness? With me today are Natalie and Emily. I'm going to have them introduce themselves right now, starting with Natalie. Natalie, who are you,
I'm
and where? What are you bringing to the table?
I'm Natalie Boileau. I am the family peer support worker at AMI-Quebec. I'm also a counselor. I think the topic today is important because everyone in their lifetime will at some point know someone or be themselves affected by mental illness. And so being able to identify some symptoms and some signs is important. So I've worked in the field for almost a decade, mainly with people with mental illness. And I think caregivers and family members are a big part of this whole journey. So nice to be
Excellent.
here today.
Thank you for being with us. And I never get this. Emily, why don't you tell us who you are and what you're bringing to the table?
Yeah, so I'm Emily Godin. I'm doing currently my specialty, my medical specialty, in fact, in psychiatry.
Okay.
So I'm in first year of psychiatry residency, and I see patients with mental illness like on a daily
Yeah.
basis, and often I need to work also with the family. I need to talk to them, and to do a bit of in fact, to inform them and to do a bit of teaching related to mental illness and the symptoms they need to detect in their relative. So we will talk about it today. I'm happy to be here.
Excellent. Thank you for joining us. And for anyone who's tuning in, just so you know, even though Emily is a doctor, she is not your doctor. So anything she says is not doctor's advice, not medical advice, nothing of that sort. If you have doctor questions, ask your doctor or a doctor that is seeing you. Don't take what she says as your. Yeah. Just putting that out there. Before we get started, I always ask a weird question. So my question today is: if you could be, had to be, a marine animal for the rest of your life, what would it be and why? Emily, you're first.
Oh my God, it's a hard question. Natalie, do you have a quick answer?
Well, I don't know, I feel like my first response would be to a dolphin
A
because they're
dolphin.
so smart, because, they're travel in groups and, I just think they're lovely beings. So
Yeah.
that would be my easy answer.
Easy answer. Emily.
I think it will be like étoile de mer. I don't know how to tell it in
Starfish.
English, but
Yeah.
starfish, yeah.
Yeah.
Because they are just like relaxing in the water all day, like and chilling.
Yeah.
So I think I will be like this, yeah.
Excellent. My choice is a reptile, and it's an alligator because they get to hang out in the sun and then get in the water. Like it doesn't get much better than
Nice.
that. So, if you have any questions, people who are watching, this is live. You can ask them in the comments, and we'll be able to put them up on the screen. Natalie, Emily, and myself can answer questions as they come up, and I'm going to type that in the comments so you can see that I just said that, and that way you know what's going on. So the topic is, does my loved one have a mental illness? What does that look like? That's like a big question, right? Like that's a huge question. So what are some of the things that we should be looking out for in general? Like this is obviously a generalized thing because there's the DSM, which is like the manual for psychologists and stuff like that tells you all the different mental illnesses, signs to look out for, and all that stuff that doctors use to diagnose. And that book is like, it's not little. So it would be impossible to say everything that people should be looking for, but what are some of the like more common things that family members and loved ones should be looking for? And then maybe later on we can like kind of narrow it down and focus a little bit. But what are we looking at? Natalie, you're up first.
Yeah, well, I feel like I would start by saying that, when we say, does my loved one have a mental illness? I think we need to be careful not to diagnose our loved one. talking about symptoms and signs that someone maybe is unwell. As we know, oftentimes actually they overlap, which is why
Yeah.
sometimes it's so hard to diagnose someone, and the course of treatment can be really long and confusing because we don't know what's necessarily what someone is experiencing, or we can't label it right away because, like I say, symptoms overlap. um, but I can say though that you can still notice when someone's unwell. And I think that some of the, very common symptoms or signs are a change in behavior
Okay.
firstly. When your loved one has started to act differently, think differently, they could either be isolating themselves or the opposite, someone who may be more isolated, usually uh, I'm not sure if I've frozen.
You're
Did
not
I
frozen.
freeze?
It's still, the sound's still coming through, so it's all right.
Okay, good. So yeah, if someone who usually is more of a loner or introvert and suddenly is not, then sometimes that can be concerning. I think hygiene is a big one too. If
Oh yeah.
someone stops taking care of their hygiene, that can also be a big sign, that it's their body, themselves, or their surrounding. So I think that the main one obviously would be a change in behavior, and I think that can sometimes be a time to be a little concerned or to
Yeah.
ask questions.
Okay. Emily, you got anything to add to that? Natalie covered a lot of different things there, so
Yes, really, and I
yeah.
agree with all of this. I think it's really important, like to have some cues related to what could be dangerous to your relatives, but not to diagnose for sure,
Yeah.
and just to provide like support, like listening to this person, and like eventually maybe uh, do the like the procedure to find someone to help them
Okay.
with them. Sometimes it's great because the patient don't know sometimes how to find a doctor or to find a psychologist. So maybe to help them in this procedure, or just like providing a phone number, something
Yeah.
like that, it will always help. But never like being like you have it, you have this problem and something like that. It's not a good way to talk
Yeah.
to your loved ones. Yeah, so we'll talk about like maybe some symptoms, and we will discuss, but
Yeah.
uh, really like global symptoms, not like really precise thing,
Yeah.
because that's not what we want to address today. Yeah, so I think that's it for the introduction about that.
Yeah. Okay. It's interesting that you said, help them by getting like in contact with like psychologists and doctors, and we just actually got a question up that says, how to help a friend who doesn't know he has mental health issues. So I guess that's in the same vein, right? It's like, okay, so you see these things in this person, but they don't see those things in this person. So how do you approach that topic? How do you start that discussion? Because that can be an incredibly intimidating thing on both sides of that equation.
Mhm.
Any of you?
I would say that there's something called anosognosia. So again, this is being not being aware that you may have challenges, either being in denial or just not, like I say, being able to understand that something is wrong. I think that that is a symptom of a mental illness, to have anosognosia. I
Okay.
think what's important is not to come on too strongly. This could be, something that break down communication with your loved one or with your friend. And so often we'll say in communicating this to your loved one to use I statements rather than you statements. So instead of saying you need help, you would say, I have noticed that you may not be feeling so well. I feel worried. I think it might be good to talk to someone about it. And so this is all, the I statements are really key. And, instead of kind of pushing or directing someone, it's good to kind of talk about how you're perceiving it,
Yeah.
in order to be able to create this communication that is not in judgment, but rather in support.
That's great. I think the I statements is like the biggest takeaway there is that for sure for me at least. Emily, what do you think about this? Like,
Yes,
this is a
I
big
agree with
topic.
the fact that yeah, like just stay open and open mind, I will say, and maybe just to say like, I'm worried about that. You change from this state to this state, and I'm worried for you because eventually you could like lost something, or I don't know what could be impaired, but you can give some examples to your loved one, and just also like maybe staying open and just like listening to what the people have to say could help the way you will address this. Yeah, so never being like so direct, and but it's really hard to tell to someone, I think you have a mental illness, when the people is convinced that he doesn't have it. Yeah, so there's a way to talk about it, and maybe also like talk with the other like person around this like sick person, family, friends, and maybe together they could like approach that problem together. Yeah.
Okay. So it's interesting you said, like, they can get with family and friends. So when so you're a doctor, you see people who come in and they're in various states of distress or not, or crisis or whatever. If their family member is there, what can they do if they're in the room? Obviously, like if they just accompany them to the hospital or wherever you're seeing them. Sometimes they won't be let in, sometimes they do. If they're in the room, what can they do to try to like help the process go as smoothly as possible?
Sometimes when we see a patient with the family, we always ask to the family if there's anything they want to talk, or they want to ask. So they have the chance to talk to us, and if they are not at the hospital, we always call them also, and the way they can help the patient to pass through this difficulty will be to stay open mind again, and to discuss like with this patient, like about what is the problem and what is the solution. Just have a discussion about that, and not like take it as a taboo, because sometimes people are not talking about that with their relative, because they think it's a taboo, and they don't want to like talk about it, but they need to do that. And I think in 2022 now, we are really, really more open to talk about it, and we understand that mental illness could affect everyone. So just address it could help, and also provide maybe asking to the relative, to the patient, do you think you need help to find like a psychologist, to go to your next appointment with the doctor, or like just to go to your appointment at the hospital, maybe to have someone in your family that can go with you. It's really, really helpful, because you feel like appuyé and compris. So I'll say that, but there is no perfect recipe to help someone with a mental illness.
Yeah. Natalie, do you have anything to add to that? Because you also see people in hospitals as well. So.
Yeah, I think I would add to that sometimes also the best way to support your loved one is to support yourself, because it can be really challenging. It can be frustrating. It could feel like things aren't going anywhere or advancing, or, that they're just getting worse. And so getting the support for yourself to cope with those feelings can be really important. Such as support groups or workshops like these, events like these are important to attend if you feel like you have someone in your surrounding that's unwell. And so I think that that's really a key thing to be able to properly support your loved one. And we say this all the time, probably in most of our videos, is that it's the analogy of putting on your oxygen mask before putting it on your loved one. And so, you need to be able to breathe if you want to help your loved one breathe.
Yeah. I mean, you bring up a really good point, and Julian talks about this in the comments here. I'll put the first part. It was like a 2-part comment there. It says, I feel like there's 2 sides of this. Many times families suffer from being on the receiving end of the behavior. And so like
Mhm.
how, it's not always like you said, Natalie, it's not always just the person who's like just dealing with or helping the loved one. It's also helping
Mhm.
yourself. Like,
Mhm.
do you have anything to add to that, Emily? Like, Natalie gave a couple like resources and ideas,
Yeah.
but do you have anything to
I
add?
missed the first part of the question or
Yeah,
the
here it
statement.
says. I feel
Yeah,
there's
I
two
feel.
sides to this. Many times families
Yeah.
suffer
Hmm.
from being on the receiving end of the behavior.
Mhm.
So it's not
Yeah.
only,
Yeah.
yeah, it's not just like that person's they may be having a hard time, but
Hmm.
you're also having a hard time
Yeah.
yourself.
Yeah. And sometimes, like the good thing to do when you feel really, really unwell because of your relative that who is sick, it's to take a step back,
Yeah.
at least like temporary, just like because you can be affected also by a mental illness if you're like too overwhelmed by this person. So just taking a step back without like being like too direct with the person, saying that oh, I don't like how you are now, you're first from a mental illness, I need to take a step back. Just saying I need to, for my own health, I need to take a step back and just like I'm here if you need help always, but I need
Yeah.
to protect myself also. It's always a good thing to do. um for sure you need to protect your friends who is sick, so you need to like be sure that there's no dangerosity in
Yeah.
anything, and if there's a dangerosity you need to talk like the police, ambulance, everyone that could be protect this
Yeah.
person.
Yeah, I think you bring up. Go ahead, Natalie. Yeah.
Well, I was gonna say, I think that's a good point in the sense that, sometimes we have to accept that we can't force our loved one to get help. If they don't want help, you can't force it. You can
Yeah.
support them, you can be there. But in a situation where they are in danger or putting someone else in danger is where maybe then there can be more force in the
Yeah.
sense that you're calling 911 to get help. This
Yeah.
is when someone is, can be suicidal or saying words that make you feel like there's an imminent risk, or there's threats of hurting someone else. These are situations where you wouldn't necessarily say, well, they don't want help, I mean,
Yeah.
what can I do? You would be able to call emergency services in that moment.
Yeah, I'm gonna put a link in the comments here, which is it's all of it's the calendar to all of the things that Emmy offers. Because one thing that really that really stood out to me, that Emily said, was saying that you need to take time for yourself and telling your loved one you need to do that. And that's about creating like healthy and safe boundaries
Mhm.
around your relationships. And that's like with family members, with loved ones, for emotional boundaries, physical boundaries. These boundaries are like, there's a lot of different types of boundaries that you can have to put into place and that you have to negotiate. And sometimes it takes you being a little bit more firm with your friends and loved ones. And sometimes, you might be a little bit more flexible depending on the situation. But those boundaries need to be established. Otherwise,
Mhm.
if someone's in need and they see you offering support, they might just keep asking and asking and asking, and because you've offered that support. But if you're like,
Mhm.
okay, I need this is where my I have to, put a pause on the support that I can offer, or being able to say, this isn't support that I can help you with, but here is someone who can,
Mhm.
right? And
Mhm.
so,
Hmm. Yeah.
and I think that that's an important part of it, is if you're not if you're offering support to someone and then you've reached a limit into your capacities, trying your best to be able to offer them something else, some other outlet, so you're not leaving your friend and loved one like hanging out to dry, essentially. At least, but at times I can see where that's not possible, right? You're just like, I'm done, I'm fed up, I can't help anymore.
Yeah, and that happens often. Like, I speak to families often where we do talk about all these ways to support, right? And how are you present for your loved one? And sometimes I'll say, well, you listen, you empathize, you speak in I statements, and people are just, caregivers sometimes will say, well, I don't want to. Like, I can't do that. I want to provide support, but I don't have the energy to do that anymore and to listen and to there. And so I think, Tony, what you're saying is really important. Boundaries are important. It's okay to be able to say, I can't today. It's my limit, because again, it comes back to caring for yourself to be able to properly care for someone. So I think that that's very important.
Yeah. David brings a good question here. And this is something that, I have a lot of opinions about. So I'm going to try to let you guys talk first here. So David says that he's had some friends tell him that they had emergency services called them and it was incredibly traumatic and made them hide their mental state better going forward. How can we intervene in that way without risking that experience? One example that I can think of is you call 911 and they have the police come instead of someone who is a little bit more better equipped to intervene in a mental health crisis. And so police come and they handcuff you and take you to the hospital or put you in a position that you take you to jail, depending on how much of a crisis you're in and what's going on in this situation. So like how, that's one example that I can think of, but I'm sure you both can have other examples, where this is something bad has happened, traumatic has happened, traumatic, same thing. Emily, do you have any insight into this?
The first thing I'm thinking is like when you feel like traumatized or like unwell because of a situation, you can always yourself ask help to discuss about it. It could be like not always psychologist, but it could be also another friend or someone you can talk to. Because it always helps to talk, as I said before. And also after a traumatic event, you could develop also like a PTSD or traumatic disease. And you could have help for that. There's a way to treat that. So for sure, you need to have help to address that. Maybe to talk to your family doctor about it also. But the way to avoid that traumatic experience, maybe I don't get the question well, but I don't think there's a way like to avoid it exactly. Maybe if you can, I don't know, just not putting yourself in front of something that you do think could traumatize you.
Yeah.
But if it's to protect someone, you need to go through this for yeah.
Yeah.
I don't know, Natalie, if you have anything to add or another way to see that.
Well, kind of like what you say, I mean, it's hard, it's a difficult situation because when you're in a state of crisis and someone comes and forces you, I mean, there's no doubt that that's traumatic, especially if you're in a state where you're so unwell that this needs to happen. That will be traumatic, and what I can say is that sometimes I will advise families, again, if someone is not in an imminent like danger of death or severe injury, that there are crisis centers, and those are psychosocial workers. So it's not, there wouldn't necessarily be physical force on someone that could be traumatic or aggressive behavior, with verbally or physically. But crisis centers like Tracom, for example, are a place where you can call someone, where they can even come and intervene with a loved one who does not want to get help. So there are places like that would not necessarily require the police to come. But again, I would say that's would be in a case where maybe it's more of like an outburst or a behavior that someone's being really loud or bothering neighbors, or in a situation like that, rather than someone being in danger physically. But it is hard to avoid a situation where there's trauma and being arrested or brought to the hospital by force. I mean, that would be difficult.
I guess my response to this would be, I personally use the police as an absolute last resort, especially when we're talking about mental health crises. I put a link in our chat to our crisis page that has crisis centers across the island of Montreal. Some are listening lines, some are people that can come and give interventions in person, some are places where you can go. There's a lot of options available to us that if you have a loved one who's suffering from mental illness who may be in the edge of crisis, maybe these numbers are good to have in your phone just as an emergency rather than 911 as your first go-to for someone in crisis. I know the police are working on trying to get better trained, but they have a long way to go. They shot someone fairly recently in NDG here who was in crisis, and he was alone in his apartment. I think it was less than a minute of interaction they had with him. So this is like the reality that people face when you just call the police. That's my try everything else before you call the cops. Within your power, within reason as well, right? If someone is obviously in immediate danger, you have to do what you have to do. But
sometimes I see a lot of people are like parents, for example, who like avoid calling cops, but they should do because the child was like violent with them or something like that. So I agree with you that like don't consider it like a first at first time, but if like there is violence, dangerosity, something like that, you can always call the police for sure. So
absolutely, I think if anyone's in physical danger, that's unfortunately the police are first responders for that kind of situation. We're not in a place where we have other resources for that yet. I think hopefully they're being created and worked on. I know there's a lot of places around the U.S. that have first responders that are specifically responding to people in crisis. We're not quite there yet in Montreal or in Quebec. So these are really great questions also, everyone. Thank you so much. And just to remind everyone, we're talking about we're not going to be going into too much into treatments and stuff like that. We are talking about how to tell if your loved one has a mental illness, how to deal with that, how to manage that. So Julian, I know you asked a question earlier, but I think that's a bit more in depth than we want to go with this topic. So one of the things that I wanted to talk about is there's we've been talking about crisis a lot. And oftentimes mental illness, I would say the majority of the time, mental illness does not involve crisis, right? It's not someone who's in an extreme state of whatever, they're just in a bad spot. So let's talk a bit about the more subtle things that we could do, that people might be experiencing. I have a list here, and so if people want to hear about these things, they can leave it in the comments. I'm going to go over them, and I think what I want to do is there's two that are really common, which is depression and anxiety, and these are common mental illnesses that we might experience in family members, and I think I want to get to that a little bit later, because I want to start with two things that are really misunderstood, and those terms are psychosis and mania, and I think that this starts to verge into the realm of crisis, but not always. I think there's a lot of people who can be experiencing these things that aren't in a state of crisis, and we don't know it, right? So let's what does psychosis mean? Let's talk about that. We hear that all the time. Oh man, that person's being psychotic. No, they're not, or yes, they are. What does that look like? How can we, if my loved one is experiencing psychosis, what do I know? What does that mean? I don't know who went first last time. Emily, you're up.
So psychosis could present in a different way, different presentation, but a frequent presentation will be someone who thinks that he is followed by someone, that there is camera in their apartment, the person feel really, really unsafe. Okay. That could be a psychotic symptoms. Cannot sleep because they feel too worried that someone could enter in the apartment or the house, something like that. It could also have hallucinations, so hearing voices, seeing things that nobody other can see. So it's more often auditory hallucination with the psychosis. So if the people said that I'm hearing voices telling me to do something like that, something we call it mandatory voices, you need to be worried about this person who's saying that, because it's a symptom of psychosis. It could be a symptoms of other things also, but the person should go to the hospital to be evaluated. And psychosis we often hear that with the consumption of drugs. It could be
Okay.
related for sure, but it can also occur without any consumption of drugs. So, if you have like like an hereditary gene that
Yeah.
can give you psychosis once in your life, you could develop that without any precipitant of the psychosis.
Yeah.
So yeah, so maybe generally it's like this, and the person could also be without having hallucination or without feeling unsafe, could be really really disorganized, agitated. It could be symptoms also of the psychosis. So it's hard to say like psychosis it's this
Yeah.
because it's really really wide
Yeah. It's a big
symptoms and
one. It's a
everything.
really like big.
Yes, it's a big one. Yeah, but
Okay.
what the yeah. So I think that's it. That will like
That's a
worry you. Yeah. Mm.
okay. Natalie, do you have anything to add to that?
Well, I guess in summary, I would say, I think that was a great explanation. I think in summary, it's kind of a difficulty of separating reality from not reality, having feeling paranoid or suspicious. And, many of the other symptoms that we described, like not grooming or hygiene and things like that. And yeah, it can be triggered. Often we do say, with drugs, but also like high stress events, trauma, reliving trauma, being, just exhausted, burnout. I mean, many things can trigger a psychotic episode. There's not like just one simple explanation. It happened because of this, and let's treat it. But yeah, I thought the explanation was really good.
One thing I want to elaborate on that I think you just brought up is that um, is someone saying is not having be able to differentiate between like what's real and what's not, and like reality and not reality, or I don't even know how to word it. You worded it way better than I just did. Anyways, the one thing I want to like comment about that is that for someone who's experiencing that, that is their reality, right? And so you can use logic and reason and say, oh, you know what? There isn't anybody in your house. We're looking through your apartment. I don't see any cameras in here. That doesn't what you're seeing their reality may not, that doesn't matter, because for them those cameras are there, it is real, and that's their reality. So sometimes it's really difficult to parse that out and like know what's what. I had another, yeah, go ahead.
Well, I was going to say, to add to that, I think that's key, because I've spoken with a lot of caregivers who are like, my loved one is saying this, like, what do I say? What do I do? And so I would have a tendency, again, there's not a simple answer.
Yeah.
Everyone is different and reacts differently. I would say, not to necessarily nourish what they're experiencing. Like if they're talking about, being followed, I wouldn't be like, oh yeah, by who? And, to like go into that and nourish it. But to not discredit it either by saying, hey, no, that's not happening. And like, of course not. Why would you? But to just kind of listen and maybe redirect towards other things. Like, what would you like for lunch? To kind of try to bring them back to reality without discrediting their experience, which, like you say, is very real, or without nourishing it by what they believe. So, I'll just have a conversation about that. But, so I think that's important. That's an important thing to.
I think one of the things that we've talked about in the past here is, I like that you said you're not nourishing what they're feeling, but I think it is important to validate their feelings around that. Oh, okay, so that's making you feel scared. I understand that. That's like their feelings around it. You can validate. The situations are not something that you have to like necessarily see like, oh yeah, okay, no, or oh yeah, who's that? What car is it? Anything like that. Like, I think it's interesting because I recently met someone in the past like 6 months, and he's, he has a bit, I wouldn't call it psychosis, but he definitely has paranoia in his life. Like it's part of his everyday living, and and he writes every license plate of a number that is driven by his house. He writes it down, right? And so this is like, he wants to make sure that he has a record of everyone who's driven by, of anyone who could cause him harm, and that like is going by. So in someone in a situation like that where they're not hurting anyone, it's just like I'm not gonna say, oh yeah, keep writing those down, that's important, whatever. But like, how do we respond to a situation like that where someone's feeling paranoia about a situation, but they're not in danger, they're not like, it's not like hurting their everyday life, but it is something that, could probably be addressed, or well, it definitely should be addressed. Like, how do we approach that with them? Maybe Emily, this is a good one for you. It's hard.
Yes, yes, it's really hard. Yeah.
Because he's not hurting
Um,
anyone, but like, it's not
yeah,
healthy.
yeah, exactly. Yeah, that's not healthy for sure. But maybe, like as you said, I'm really, really, I agree with that. The fact that you need to validate the emotion of the people feeling worried, feeling anxious, without like saying that's true. There is camera over
Yeah.
there. But with someone who's like recording all the the numbers of the I think you just need to ask why you need to do that,
Yeah.
what it helps you inside, and is there any other things you can do instead of that is more like healthy or something like that. But it's really hard to discuss about that. I think this person really need a professional
Yeah.
person to take care about that. And maybe also, if it triggers you, the fact that this person is paranoid, just avoid talking about it, and just trying to get back in the reality, and just
Yeah.
yeah. But if you're worried about this person and the impact on their health, uh, as we discussed before, just talk about that. Talk about the fact you're worried about this comportment, and provide any numbers that could help this person.
Okay. Natalie, you have anything to add to that? That was a
I
very
think
specific scenario, but it was one that popped
yeah,
into my
it
head.
is, and it's good because it kind of summarizes many other situations that are very similar. So I would say again the I statements, asking questions, but also saying I'm concerned. That this is your reality. I'm worried that it's obsessive or it's making you feel this way. Maybe you can. So I think that, but also the LEAP method, which is another, which is LEAP, listen, empathize, agree, and partner. We can share, I won't go into like explaining the LEAP method because it's long, but I would read about that because that's about doing kind of what Emily just said, listening, trying to understand, okay, I see that you're concerned about this, agreeing on their reality, and then partnering and possibly addressing it or finding solutions, or finding a course of action, or also just saying, I will let you do that if that's what you need to do. So, I think that would be a good way to be able to address a situation like that.
I'm looking really quickly. I'm pretty sure we have a article in one of our newsletters that is about the LEAP method. I'll try to find that and post
There's
it up
the
later.
Amador, the
Yeah.
psychologist, the psychiatrist, I think, who created that. There's a
Yeah.
TED talk. If you wanted to share that, he explains it pretty
Yeah,
well.
okay, we can share that afterwards. Yeah, I think that's a really good, like, the LEAP method is an important thing for folks to know about. We talked a bit about psychosis, and now I want to talk about mania, because mania is often also another one of those ones that's like misunderstood, and like, you know, I try to give examples of mania, but I'm interested in hearing what you two have to say, because I feel like mine is not necessarily a good one that I give, and I'd love to be able to give a better example of someone experiencing a mania. So what does it mean? Emily, you're the doctor, so what is a mania? Like, what is someone experiencing
Yes.
mania?
Yeah, in general, we describe it as the contrary of depression.
Okay.
So instead of being down, you are really, really high.
Yeah.
So there is like normal mood, and there is like depressed, and there is manic. So
Yeah.
you're all like really, really exalted. You have many projects. You speak faster than normal. Thoughts are racing also often, and the person can also be more irritable. There's more anger content, and sometimes there is also delusion. As in psychosis, the person with a manic episode could have thought who is not who are not in the reality, so convinced that someone is following her, or convinced that someone cheat on her, for example. It's an example for sure, but globally it's being high instead of being depressed.
Okay. Natalie, you got anything to add to this?
Yeah, well, I think that's, that's what it is. It's being extremely high, and I think that people having like all these grand ideas suddenly and all these projects and not sleeping is like a big symptom of mania, and being like awake for hours and days.
Yeah.
Those are, I've witnessed that, and so that's like a sign that something is not, and I think that would mania often is one that's a bit easier, I guess, because it's so intense and rapid and like exhausting for others. It's I think that's maybe sometimes a little easier to kind of understand. My loved one does have a mental health.
It's interesting because all these things you say, and we talk about not like diagnosing people, and I'm like hearing you guys saying, okay, they have a lot of projects, they don't sleep, they talk really fast, they're always doing something, and I'm like, uh-oh. That's all I'm thinking about myself. I'm like, wait a minute. Hold on a second. I don't think I'm in a state of mania, because that would be my entire life.
And
but
there is also a spectrum. So there is like
yeah.
your own personality of being like proactive, sometimes high.
Yeah.
And there's also a hypomanic episode, we said. So it's not like manic, it's hypomanic. So it's less like grandiose. You don't need to be hospitalized for that. Yeah, so there's a spectrum for that. And also the only thing I want to add about the manic symptoms could be like the person changing clothes, changing color of hairs.
Okay.
It's like that doesn't fit with her own pattern of
The example I always give when I talk about mania is someone they feel like they're indestructible. They're like, nothing can possibly go wrong. Everything is right. And so they'll go on a huge spending spree with a credit card. And then, a week or two later, they have to deal with the consequences of all these things sitting in their house, their credit cards being maxed out, and like not knowing what to do. And that's like one example that I always give of like someone who's experiencing a state of mania. They're like, I can just buy everything. It doesn't matter. I'll have this figured out, blah, blah, blah. And they just boom, 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 boom. And then dealing with the consequences of it at the end. And that's where like a loved one and a family member might see this pattern, especially if it's someone you live with and you're like, wait a minute, why are we getting like, 50 packages in a day? Like what's going on
I
here?
would add, money is a big one in mania, I think. And I would also add that often people who are manic give stuff away a lot.
Oh yeah.
They also buy a lot of things, and there's excessive spending, but there's also like generosity of like, here, I don't need this, and giving all their things away, I think is quite a common symptom. Or something to look out for as well.
Interesting. So again, we are live. We've got about 15 minutes left. I'm going to cover some more things, but if you have any questions you want to ask, please do so in the comments. We're here with Dr. Emily and Natalie. I was going to give you a weird title, and that doesn't make any sense. The two more common ones that are experienced, that our loved ones, family members, friends might be experiencing, are depression and anxiety. We can lump them together. We can talk about them separately. Let's talk about those two, because I think those are the two most common things that our family members might be experiencing, and they may not realize that it's affecting their lives, right? Depression more so, I think, than anxiety. Anxiety is a bit more like, when you're like, oh God, that's like, it stresses you out. You have a little bit more, but like, I feel like people might be a little bit less able to see when they're in a state of depression or not. So what does that look like? What is you talked a bit about it before, Emily, about depressions being lows. Do you have anything else to add to that, of like what it's like to be in a state of depression?
Yeah. So depression, it's as I said, being low, feeling depressed almost all the day, crying often, having less interest in activities that normally the person like to do. The desire to stay alone in bed, crying. sleep could be increased, but also decreased. It depends. And some normally there's a change of appetite, so the person could like eat more or eat less. And it should last at least 2 weeks. So if you like have depressive symptoms for 2 or 3 days, it's not
Yeah.
so a depressive episode. And depressive symptoms could also come with a stressor in life. So we don't call it a depression, we call it a trouble d'adaptation, adjustment disorder.
Okay.
And it could happen after like anything in life, a stressor, you lost your job or something like that. And you could be depressed for a few months and it resolves after when the stressor is resolved. And also there is often suicidal thought, suicidal ideas related to the depression. So that's the thing we need to, like the relative need to ask to the person who feel depressed, because if there is a dangerosity for this person, we need to call someone to pick or maybe to bring the person to the emergency, for example, if there's an imminent danger for their life. So globally I think it's that depression, it's more like common.
Natalie, you have anything to add to that? That was pretty thorough.
Yeah, I feel like both anxiety and depression, again, not to group them because they're different, but I have a tendency to think of them too as like very physical. So, for depression, again, the like appetite change and being tired and exhausted and feeling heavy and out of energy. I mean, I think that those, like anxiety, can be very physical. So like like having a rapid heart rate, trembling, sweating, like having this feeling in your body where you have like this weight or this, impending danger that you feel physically. Not that, the others that we discussed today aren't physical, but to me, I feel like those can be really determined by those physical changes. But yeah, I think that those were, obviously great examples of what depression is. It's the
so we know what it looks like. How do we like bring that up with a like family member or a friend or a loved one that is just like, okay, we see it, but they don't see it. It's been a month now. What do we like? How do we respond to that? How do we bring it up? Natalie, you go first this time.
Well, I mean, I feel like it would be all the things that we've mentioned. I feel like it would be talking about it, expressing your concern as a loved one again, and like, I've seen that you haven't been getting out of bed, and I'm really worried. Would you like me to help you find places to talk about it? Do you want to talk about it? Can I do something to help? Like sometimes it's just listening to, because sometimes, I think often we have a tendency to want to fix it, but listening can go a long way, and just being there, even if it's just coming over and doing nothing with that person, that can be a huge thing. And you're not actively finding a solution, but you're there. So yeah, I think that talking about it with others too, of that other family members or friends that are related to that person, is a good thing you can do, just to be aware that someone is unwell, and to create kind of this support system whenever that person is ready to do something or, address it. I think too, as a caregiver, what's really important is to kind of do your homework. And so read about anything that you're seeing, that it be a manic episode, a psychotic episode, depression, anxiety. I think it's important, if you want to help, to get informed and do some learning on what that is, and what that person's experiencing. I think depression too, often people tend to be like they're lazy, and there's this stigma around certain of these illnesses, and so sometimes that's not helpful. But being able to read about it and really understand what that person is experiencing is important.
Emily, you have anything to add to that?
The only thing would be that the crisis center could also help for depression and anxiety. So it would be resources that are helpful. And also the other thing I want to add is that depressive symptom could be caused like by alcohol usage because it's a depressant, and it causes depression. So
Yeah.
just something to have in mind. Yeah.
Yeah. One thing I think is important to just like restate is you both had said, using I statements. And then, but I think it is important, and you spoke about this a bit, Natalie, is saying like, I've noticed that and then pointing out specific actions that that person might not have noticed. And so you're still using an I statement, but explaining what you're seeing that person is doing. Like, I've noticed that you're in bed all day long and you haven't gotten out of bed in a few days and you've been ordering Uber Eats. It's been a month. Like, what's going on? Like, how can I help? Like, you're still bringing up, you're still bringing up what that person's doing without saying you're doing this and this is bad. Like, you're expressing it from like your perspective and not just like a judgmental approach. I think a non-judgmental approach is incredibly important too. When we're talking to people about these things, is that like, if someone had a broken leg, we use this example all the time. You wouldn't be like, oh, well, you're just not walking fast enough. Like, what's your problem? Like, it's the same thing when someone's experiencing a depressive state. You're not like, oh, you're just depressed. Like, why aren't you doing these stuff? Like, you're not going to work. Like, you're just depressed. Get up and go. Like, that doesn't work that way. So we got about 8 minutes left. Let's talk a bit about anxiety, because that one I think is a bit harder. Like a depression, for me, at least for me, to wrap my head around, right? Like, I can tell it's easy for me to like, or not easy, it's easier to see, I think, the symptoms of depression showing themselves maybe more so than anxiety. And I could be wrong about that. Like, what are your, let's start with what does anxiety look like? Emily, doctor.
In fact, Natalie, go ahead.
Yeah?
I think you had a good description, a few minutes
Okay,
ago
go for
about
it.
panic attack.
Yeah. Well, I think, what I said. So I think that anxiety, I agree. I feel like some people may have anxiety and be able to hide it better. But, feeling nervous or tense or restless, having, again, this like impending sense of panic or doom, or that the worst case scenario is going to happen. Kind of this overwhelming feeling that's constant, right? And again, the physical things like breathing faster, sweating, hyperventilating, heart rate, trembling. So I think that those to me is what anxiety is. I think in the state of the world today, we need to look out for that because of everything going on. I mean, it is like, it's anxiety, it's chaotic, and so I think it would be very normal to be feeling that, but it's important also, when you do that, to find those things that make you feel good, and to figure out those coping skills, because it's difficult to function when you are feeling all those feelings.
You have anything to add to
And
that?
yes, and there is also difference between stress and anxiety.
Yeah.
So stress, it's more a normal response. You have like an imminent stressor, or something happen in your life. You have a presentation to do to tomorrow, or you have an operation you will receive tomorrow. So something like that, it's normal to be stressed about. But anxiety, it's something like more abnormal, more like your own personality is more anxious, and you can have a lot of physical symptoms related to anxiety, as you said, Natalie. So I think for the relatives, it will be to see those physical symptoms that could be anxiety, and to recognize it will be a good part of the process. Just recognize that this is anxiety, and you can work on it. There is many things to work on anxiety, not only pills. Just like doing sports can reduce your anxiety. So it can affect everyone with any other problems, but it can only be anxiety also. And there is help for that. As I said, you can just talk about it with a psychologist, going to crisis center if you feel really anxious. Talk with a friend, go for a walk, taking deep breath could reduce your anxiety. Yes, and there's also like anxiety in general and some specific anxiety illness. For example, um, like if you are worried about seeing a spider, it's anxiety, but it's only related to the spider. So you need to know that also, but it will be with the professional that you can address that.
Yeah. I think, well, you brought up a good point, I think, which is that there's stress and then there's anxiety, and stress can be, but stress can also, like, people can be putting themselves in extremely stressful situations unnecessarily or overly, and that is also a health risk. And so this is also something that we need to be like, if you see that your friends and your loved one is like constantly stressing about this and that, like maybe bring it up with them, like, hey, you try to use a calendar or schedule your life a little bit differently, or just like working on ways of like reducing stress in your own life. Like I know that when I have a day filled with like 8 meetings and I don't have a chance to stop and breathe and break, I'm gonna be stressed out all day, and then nothing good comes from that. I don't eat. I'm not happy. Like,
I
yeah,
think that's key though, to be able to identify those, in French we say les facteurs de risque, les facteurs de
yeah, risk
protection, and like
factors. Yeah,
yeah, exactly. Being able to identify what may be contributing to this anxiety or
yeah.
what you're carrying. Like, Tony, if you have 8 meetings, well, maybe spread them out
I
if you
don't need eight
can,
meetings in a day.
exactly. And again, what makes you feel good, like the protection risk. So what makes me feel good, and to be able to identify those, and be aware of them and use them, right? So I think that that's also key in addressing any mental illness or mental health challenge.
We do have a question here. Do you find that some people who overthink and worry a lot constantly, but are also struggling with anxiety? I'm going to have to leave this to you two, because you two are the ones who see people way more often than I do. So, like, my
Yes,
immediate answer is yeah, but
in fact, struggling and worry a lot, it could be like normal, but it
yeah,
could also be anxiety. The fact
yeah.
that the person is worried, thinking the worst scenario of always. So I'm not sure what is the question. Yes, but anxiety could be like having those
Yeah.
thinking of being worried. Yeah.
I think.
For me,
Yeah, go
oh,
ahead.
go ahead,
Go. No,
sorry.
no, no. Go. I asked you to talk, and then I jumped in.
Well, I was just going to say that, for me, it's important to identify if this feeling is impacting your daily
Yeah,
functioning.
that's the
And
key.
so if, this is something that you have, but, you're able to eat and like see your friends or your family and go to work, and, you can cope with it. But when it's starting to impact your functioning and you can no longer take care of yourself in the way that you used to or usually do, I think that's when it could be addressed.
Yeah. Yeah, I think that's key,
Mm.
right? Like everyone experiences anxiety throughout the day, when the day, like for whatever reasons. It's when when you're like, okay, I'm so anxious I can't make food. I'm so anxious I can't go out.
Mhm.
I'm so anxious I can't get work done. I'm so anxious I can't. If these are things that are coming up, then it's something that needs to be addressed. And I think that's the difference between our like the anxiety we might be experiencing on our like baseline versus other times in our lives, and when it
Mhm.
becomes like something needs to be, you might need help with, either through friends, family, therapy, medicine, doctors, exercise. There's like, you know both of you have mentioned a million ways of like helping with it. So um our time is up. I wanted to say thank you so much to Natalie and Emily for joining me and talking about this. This was like an incredibly informative little workshop we had here. Do either of you have any parting words to say a bit adieu with? Emily
Yes,
shook her
Well,
I
head
it
have
no.
to
was
say,
yeah. Well,
I would reiterate that again, everyone in the world, will be affected by mental illness or mental health challenges, that it's you living with it or someone you love.
Yeah,
And so, although there is more stigma around, mental illness than physical illness, it is just as present, and sometimes even more so. And so, we need to be able to talk about it. And so I encourage you, you are not alone. You never will be, to get help and the support that you need, that if you're a loved one or someone living with a mental illness.
Emily, anything?
Yes, I agree with Natalie, and just asking help, it's really, really a big step when you feel unwell and you feel that you can have a mental illness or mental health symptoms, problem, in fact. So just asking help, it could be really, really efficient and helpful. So I encourage you to do that and to help your family to do that also if they need. So thank you everyone for listening to us today.
Yeah. Thank you very much. And I just erased my name by accident. This is our phone number at AMI-Quebec, 514-486-1448. If you're having a difficult time with your loved one, if you think your loved one is having a difficult time, reach out to us. We can try to help get you the resources you need, direct you to the resources you need, and get you the information that you need. Thank you for joining us, and we'll see you next month. Bye.